So when you were here, this haikuwa.
Yeah, tulikuwa tunakaa hiyo later.
I'm Steven Musia, the CEO of Nyeri Hospice. Nyeri Hospice has been in existence for the last 27 years. Our main objective or our main service we provide is palliative care, whereby we normally take care the patients who have terminal illness. Currently, in Nyeri count, we have over 836 patients, although there are other patients from neighboring counties who do receive our services. Our services we do give for both outpatient and inpatient. So we have opened an inpatient whereby these terminal patients can continue receiving holistic care in our facility. We also do the home-based care, which is our hallmark, or the care which we do at home, whereby the clinical team do visit the patients at the back of their home. They assess the patient, they provide the patient with the medicine, and they do training the families on how to care their loved one or the patient. At the same time, we do over a family conference. We know if a patient is suffering, it's not only the patient who is sick, even the family members are affected. Therefore, we do the counseling to both the families and the patient. And also, we train the community to overcome the stigma, because there is a belief once somebody gets, let's say, cancer, it's a death sentence, which for we in the Nyeri Hospice, we do not believe that having a cancer is a death sentence. We can manage it. We have patients who have lived with this cancer for the last 30 years, and we are still journeying with them, receiving the psychosocial support. With this rise of the number and the economical crisis, we find that to receive or to get these commodities sometimes is very challenging. Uh, for example, like colostomy bags. To get the colostomy bags is a big challenge in our country, whereby these colostomy bags, they are very expensive, and you find one goes to 1,000 in the market, and the patient may need to use one or two or three in a day. So we find some patients being very creative using plastics, and these plastics affect their body, and because they cannot afford to buy just a single colostomy bags. So that's one of the biggest challenge as hospice currently we have, to get enough colostomy bags, because we have a big number of patients who are from very poor background. They have used all their resources, and now they cannot afford to buy uh, the the colostomy bags. We also have the challenge of food. Sometimes our team goes to the family and finds the family have no food. So we find it's a big challenge, and this we call the community to support us, because you cannot give a patient drugs yet this patient has not eaten anything. So that's is one of the big challenge we have in the community, and Nyeri Hospice exists because of the community, and we do appreciate for the last 27 years the support we have received from the community, and therefore we urge the community to continue supporting these our brothers and sisters who are suffering because of the terminal illness. On the upcoming Saturday, we are organizing a charity walk, and we do invite the friends and the friends of the hospice and friends to join us to raise funds to support this great number of our patients. Thank you.